A continent away from the worst of the outbreak, a warning against complacency.
The best way to help people in countries which are not infected is to help people in the infected countries. We should not think that these infected countries are so far away and therefore we are safe from this disease.
European help is on the way for Liberia, Sierra Leone, and Guinea. EU countries have already pledged 500 million euros in aid. That's $640 million, a figure they hope to double. But many on the ground say the help hasn't come fast enough.
The international staff that is needed to be deployed, especially in the treatment of Ebola patients on the ground, has still mainly not arrived. We don't just need medical experts, doctors, nurses, etc., but we also need logisticians, we need water and sanitation specialists.
The Berlin participants have issued a declaration which includes a commitment to rebuilding local economies that have been devastated by the outbreak. Many in the scientific community believe the crisis could have been prevented through closer cooperation.
We did not have the infrastructure in these countries to really have observations, to have good data, and to communicate that in reliable ways to the outside world and then react.
Vaccines which are in the pipeline.
Prevention remains a primary goal of the global response.
It is always said that there are no vaccines and no drugs available against Ebola virus. This is correct only to some extent. There have been vaccines available which are still on the experimental level for a decade already.
But there is regret here that the sense of urgency didn't come sooner. The summit won't only focus on Ebola. The spread of other infectious as well as non-communicable diseases is on the agenda. And while the global response to Ebola seems to have raised more questions than answers, people here are hoping that perhaps we won't make the same mistakes next time. Ira Spitzer, CCTV, Berlin.